This is 8.3, administering 6 fitness tests. So I started off by doing a client consultation so that I could understand what my participant wanted from this. So their name is Emily, their date of birth is the 29th of March 1966, they're 156 centimetres tall, 54 kilograms, their BMI is 22.1, which is in a healthy weight, and they live in West Sussex. So I started off by asking what sports and exercise she enjoys the most, and she's always enjoyed swimming and netball, and she also added in that she doesn't do much exercise at the moment. So I asked if she's participating in a club or like a sporting event. She said no, but she's looking to maybe want to start water polo. And then I asked if she had any sporting goals that she would like to accomplish. She said she wants to become stronger and start to do more exercise more regularly, and to maybe improve some components of her fitness, specific for water polo. I then went on and did a health screening questionnaire for her. So I asked her if she's experienced any of the following health issues, so heart attack, heart disease, diabetes, asthma, tuberculosis, cancer, muscle or nerve diseases, any recent breaks or fractures, strokes, accidents or operations, and she has mild asthma, but she has an inhaler for it. And then I asked if she had any allergies, and she has an allergy to penicillin, but it's mild, so she doesn't need medication for it. I then went on to informed consent, so I asked her to answer the following questions. So I said, I understand what is being asked of me, and she said yes. I understand that I have a right to withdraw at any time. She said yes. I understand that my results may be kept confidential unless it needs to be shared with a GP. She said yes. I have truthfully completed this personal readiness questionnaire and health screening. She said yes. I understand that there are possible risks that could happen during the fitness test. She said yes. And I understand that I need to notify the researcher if I have any concern about anything. And she said yes. She signed it, and she dated it for the 7th of February 2021. I then went on and performed a risk assessment. So the activity that we were assessing were for the fitness test, and it was assessed by me on the 7th of February 2021. So the first hazard is sustaining an injury, and this obviously is a risk for the participant. So the controls to be put in place are to make sure that the participant fully understands the exercises that they're doing, because if they do the exercise wrong, it can result in injury. Also, if they feel any pain at any point, they should stop, and also if they have any current injuries, they should not take part. The likelihood of sustaining an injury is fairly likely, so this puts them at a medium risk rating, and the outcome would be an injury. So the necessary actions are to make sure the participant does a warm-up and cool-down, because this reduces the risk of injury and the strain that's put upon the muscles. You need to make sure to check for existing injuries beforehand, because they may not feel they need to bring them up unless you ask so. The next hazard would be slipping, tripping on uneven floors or slippery floors. So people at risk are the participant and the assessor. So the controls will be in place are to make sure that a reasonable surface is used, and to check that it's clean and non-slip, and there are no tripping hazards before we start the fitness testing. So the likelihood is fairly likely, again quite likely, so it puts us at a medium rating. The outcome of this would probably be sustaining an injury. So the actions that are necessary are to perform the test in a clear space with a clean, even floor that's not slippery. You also need to make sure that you're wearing proper, sensible shoes, because wearing socks on a slippery floor will increase the risk of injury, whereas grippy trainers will prevent slipping more. This is at risk to the participant, obviously because they're taking part in the fitness test, but it can also be at risk for the assessor because the assessor may trip when filming or when recording the time that it takes the participant to do the stuff. The next hazard would be transmission of COVID-19. So the people at risk are the participant and the assessor and anybody else who's in the facility that we are using for the fitness test. So controls to be in place to make sure that we follow all the legal rules that are put in place at the moment so that we aren't put at risk and so that the participant isn't put at risk and so that anyone else who is using the same facilities as us aren't at risk. The likelihood of this is fairly likely and the risk rating is high because the outcome could be a serious serious illness and even death. The actions necessary for this are to maintain social distancing at all times, to wear masks at all times, except the participant when they are performing the actual fitness tests, and to make sure to do the test outside if possible and if it's safe to do so. And if you do it inside, to make sure to leave doors and windows open for ventilation. Also, if it is possible, try and use someone within your bubble to reduce the transmission. Another hazard are previous and current health concerns. So people at risk are the participants. So for my participant, she has asthma, so I have to make sure that she has an inhaler on them, just in case they have an asthma attack. The likelihood of this for my participant is quite low, but it's fairly likely that this will happen for other participants, so it puts that at medium risk rating, and the outcome would be illness. Actions necessary are to make sure that the participant doesn't push themselves too hard and that they know that they can stop at any time. They need to make sure they put their health first, so if they need to stop, they can, and they don't need to feel obliged to continue. And the last hazard would be dehydration. So this could happen for the participant and the assessor, depending on the weather. So the controls to be in place are to make sure that water and shade are available. So the likelihood of this happening is affected by environmental controls and variables. So, for example, if it's a really hot day and the sun's out and you're doing the fitness test outside, then the likelihood is going to be more likely, and the outcome could be illness, like heat stroke or dizziness, or they could pass out. Actions necessary for this are to give water breaks or allow the participants to have water whenever they need to, especially if the weather's warm, and you also need to make sure that there is shade available if you are doing it outside. The next thing we're going to talk about are reasons to defer or terminate testing. So if the environment being used becomes unsafe or presents hazard, we should terminate the testing to make sure that the participant and the assessor are both safe. If the equipment is damaged or unsafe to use, we must terminate testing. So if we are checking it, so we must check the equipment before we use it. If the client requests for the session to be terminated for any reason, then we must, and if they request to leave the test, then we also must terminate the testing. If the testing takes place outside and the weather makes the testing unsafe, we should terminate the testing. So when me and my participant did our testing, we were meant to be doing it outside, however it snowed, so it was unsafe for us to do it outside, so we went inside and we did the test inside. However, if it was unsafe to do it inside, we would have to terminate the testing and rearrange it for another day when the weather's better. So if the participant shows any sign of illness or asthma attacks or nausea, dizziness, you must terminate the test because the participant's health comes before anything else. Also, if the participant becomes injured, we must stop and get the medical attention if necessary, and if not, stop to allow the injury to heal, because if you perform on an injury, it may become worse. So I chose 6 fitness tests for 5 components of fitness for my participants. So I started with the stalk stand test, which is used for balance. So for this test, you have to stand with all of your weight on your dominant leg and then put your non-dominant foot on the side of your knee. You then place your hands on your hips and you rise up on your tiptoes, and once you've reached that position, the assessor will start the stopwatch and you balance in that position for as long as you can. As soon as you put your heel down or you put your foot down, the assessor will stop the stopwatch. So requirements for this are a stopwatch and a non-slip floor. The next test I did is a standing broad jump, which tests for power. So you stand with your feet hip width apart and at a cone, so your front of your toes are in line with the front of the cone. You then bend your knees and jump as far forward as you can. You may swing your arms if you feel it will help you. Once the participant has landed, the assessor will place the cone at the back of the heel. The assessor will then measure the front of the cone to the back of the cone that are placed down, giving us a result. So requirements for this are a tape measure, cones, and a non-slip floor. The next test I did is the ruler drop test to test my participant's reaction time. So you place a 30 centimeter ruler or a 1 meter ruler just above a participant's dominant hand between their thumb and finger, having their thumb facing the participant horizontally and having the participant have their hand vertically. You then place the ruler just roughly 1 centimeter above their finger between the gap, and you need to make sure that the 0 on the ruler is at the bottom. The assessor will then randomly drop the ruler and the participant must catch it as quickly as they can. Once the participant has caught the ruler, the assessor will measure in centimetres from the bottom of the thumb. So requirements for this are a ruler and also, I guess, an assessor. The next test is a wall sit for muscular endurance. So you sit against a wall in a seating position as if you're sitting on a chair, with your knees at around a 90-degree angle. Once this position is sustained, then the assessor will then start the stopwatch, and they must stay in that position for as long as possible. As soon as the angle of the knee changes, shows a big difference, then the stopwatch will stop, or as soon as the participant comes out of the wall sit position, then we will stop the stopwatch. So a requirement for this is a non-slip floor, a stopwatch, and a flat wall. So the next test that I chose is a ball toss test, which measures your participant's coordination. So you stand roughly a metre away from a flat wall, with your knees slightly bent. You start with a tennis ball in your right hand, and then you throw it against the wall gently in an underarm fashion, and then you catch it with your left hand when it bounces off the wall. You then repeat this from your left hand to your right hand. The assessor will count the amount of times that they catch the ball within a minute. If the ball becomes dropped, then you must pick it back up and stand back roughly a metre away and continue until your minute has stopped. So the requirements for this test are a tennis ball, a flat wall, and a stopwatch.